Bag and mask ventilation after 30 seconds. After providing adequate ventilation for 30 seconds, assess the baby for breathing. If the baby is not breathing, then call for help. As already explained in beginning, call another healthcare worker trained in NRP. Balwant, attach the oxygen. If more than 40% of oxygen required, then only attach reservoir. Otherwise, ventilate without reservoir. Evaluate heart rate of baby. For counting the heart rate, use stethoscope. Stethoscope is to be placed on the left side of the chest. Now, count the heartbeats in 6 seconds and multiply it by 10. The resulting number is the heart rate of the baby per minute. For example, if there are 12 heartbeats in 6 seconds, then 12 multiplied by 10 is equal to 120. So, the heart rate of baby is 120 per minute. If the heart rate is more than 100 per minute and the baby is breathing, slowly reduce the rate of ventilation and stop it. Confirm whether the baby is breathing well or not. A baby is breathing well if the baby is crying vigorously or has good rhythmic chest movements. If the baby is breathing well and bag and mask ventilation is given for less than 1 minute, then shift the baby with mother for observational care. If the heart rate is more than 100 per minute and the baby is not breathing, continue ventilation with bag and mask, and after every 30 seconds assess whether the baby is breathing or not. As the baby starts breathing, decrease the rate of ventilation and ultimately stop bag and mask ventilation. If bag and mask ventilation is given for more than 1 minute, then shift the baby for post-resuscitation care. If the heart rate is less than 100 per minute, ensure chest rise, and if necessary, again take corrective steps for ventilation. Continue ventilation with bag and mask. If a healthcare worker trained in full NRP is not available at your facility, then immediately arrange for shifting the baby to a higher center. During transfer, continue ventilation with bag and mask. When to stop resuscitation? Bag and mask ventilation should be continued until the baby establishes spontaneous breathing. However, if there are no signs of life to begin with, that is, no breathing, no heart sounds, and no movements at birth, and remain so even after 10 minutes of birth, ventilation may be stopped. If there are any signs of life during resuscitation, then the resuscitative efforts must continue for 30 minutes before terminating the same. When withdrawing or withholding resuscitation, care should be focused on the comfort and dignity of the baby and family.